September 23rd, 2025. Good morning. I'm Dr. Deuk Majan, CEO and founder of the Deuk Spine Institute. Our patient travels from California, where he had artificial discs put into his lower back in his spine at L4-5, L5-S1. Look at the x-ray. We're looking at a lateral view. You can see the artificial disc. So if he had artificial disc, then why is he here today? Two reasons. He's having horrific back pain. It's totally disruptive to his life. Message: artificial discs do not fix back pain. Artificial discs do not fix back pain. People have problems after artificial disc surgery. The most common problem that's related directly to the artificial disc, number one, facet joint pain, which he has. Facet joint pain. Basically, they fixed the disc, but they didn't fix the facet joints behind the disc, and people still have pain. Number two, adjacent segment disease. Take a look at that L3-4 disc, folks. It's worn down. So it turns out artificial disc patients have the same adjacent disc disease, adjacent segment disease complication rate as people with fusions. The whole industry sold everybody on artificial discs, saying if you get an artificial disc put in your spine, you won't get adjacent segment disease, you won't have to come back and have another surgery. It was a big lie. They lied to you, they lied to the surgeons, they lied to the hospitals, they lied to everybody. The rate of adjacent segment disease in artificial discs is the same as patients who get fusion. It's high. It's very high. It's probably somewhere around 25 to 50% of patients end up needing additional surgery. This patient comes to us with both adjacent segment disease above his artificial disc at L3-4. He also has facet joint pain, chronic back pain related to the L3-4, L4-5, L5-S1 segments on the left side. So today we're going to be fixing a disc at L3-4. We're also going to be fixing facet joints with the Deuk plasma rhizotomy. I want to make one more point. If he had come to us originally and did not have artificial disc put in, by the way, that's a horrific surgery through the belly, high complication rate. We would have done the laser surgery. He would not be back today with adjacent segment disease. The Deuk laser disc repair surgery does not create adjacent segment disease, ever. We've been doing it 20 years. We have zero adjacent segment disease. All right, let's get started. We're going to start with treating L3-4. Put your head down, my friend. Lay still. And maybe we can get Dr. Berndes to do some anesthesia. All right, little injection, some numbing medicine. Just lay still. You're doing great. Now, this gentleman is a big guy, big and beefy, and we had a great talk. He's originally from Chile. He now lives in California. My home state, where I'm from originally, is California. You're doing great. Yeah, we would like to if we can, but we don't have to. If you tell me it's not possible, then I won't do it. All right? Any questions, type them up. In the meantime, since we're talking about all these different things that cause back pain, like discs, facets, SI, piriformis, and he does have SI pain as well. He just chose not to treat it. We're going to probably have to treat it in the future, unfortunately. You're doing great. We're just putting some numbing medicine. Henry, let's show the audience all the different causes of chronic back pain. I'm Dr. R. Deuk Majan with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deuk Majan. Thanks for joining us.
You're welcome, and welcome back. You can see from our video, there are about 40 things that cause back pain, chronic back pain. We distinguish chronic from acute. Acute back pain is, say you get into a car accident today, you're having back pain, today, and then it goes away after a few days. That's not chronic back pain. We don't count that in our data. And the way we collected this data that you just saw in the video, we had 5,000 patients with chronic back pain, and we broke down the cause of the patient's pain in each case, and the primary cause, which is the main cause of back pain, and of course secondary causes. And it turns out the primary cause of back pain is the disc in 85% of patients with chronic back pain, 85%. So the disc itself, damage to the disc, is the most common cause of back pain. And same thing in the neck. If you have neck pain, 85% of the time it's the disc, an injury to the disc. So what are those injuries? You can actually see those injuries on an MRI. You have annular tear, disc bulge, disc herniation, protruded disc, extruded disc, ruptured disc, slip disc, bulging disc,
and degenerated disc, spondylitic disc. Those are the names to look for. If you have one of those, or you know somebody with one of those, and they're having chronic pain that lasts more than 2 weeks, then they probably have pain from their disc. It turns out the average patient we treat and cure their back pain, they have 2.5 discs. 2.5, that's 2.5 discs per patient that are causing pain. In this patient, it's 1. He has 1 disc causing pain. It's L3-4. The reason he has an L3-4 only is he's already had surgery on L4-5, L5-S1 done elsewhere, I think in California, as a matter of fact. And the doctor that did his surgery, Dr. Rick Delamater out of California, I know Dr. Delamater, not personally, not as a friend, but apparently they're telling me he became a monk. Did you really? Yeah. At UCLA, right? Yeah, you were his intern. Amazing. So he's left medicine now, he's become a monk. I guess he's trying to get forgiveness for all the bad spine surgery he did. I'm just kidding. Anyway, that said, I don't expect to become a monk because I sleep well at night knowing I do what's best for my patients. Now, Henry, this patient has 2 things causing back pain, the disc and the facets. And the reason he's having all these problems is he had artificial discs put in his back, and those artificial discs cause adjacent segment disease. They also cause facet joint problems. We're going to be fixing his facet joint problems next. So why don't we start, though, by showing the audience how it is that a disc injury causes so much back pain, like this L3-4 disc injury.
Of course. Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
All right, welcome back. You can see from our video how it is that a disc injury, such as an annular tear or disc bulge, herniated disc, etc., how they cause so much pain. And the answer lies in the simple fact that the body itself is always trying to repair things on its own without you even knowing about it. And it uses this technique called inflammation. Well, inflammation, we now know, and most people are pretty smart about this, is inflammation causes pain, lots and lots of pain, and destruction, lots of internal destruction. Inflammation can be damaging when it gets out of control, but inflammation is also a necessary part of healing. If you have a broken bone, you need inflammation to heal it. If you have a cut on your skin, you need inflammation to heal it. If you have damage to your organs internally, you need inflammation to heal it. God damn it. And if you have infection, you need inflammation to fight it. Okay? So the point is, inflammation is a normal part of life. It is an important biological process found in the human body. You got to pay attention to that stuff. Okay? And the problem happens when it gets out of control or it's inappropriate. It does inappropriate inflammation. And that's what's happening right here. We are at the back of the disc. Right here you can see all the inflammation. That inflammation should not be there, but the body is trying to heal this herniation itself, but cannot do it. No herniations are healable on their own. People ask me that all the time. Dr. Deuk, I heard that a disc herniation can heal itself. No, it can never, ever heal itself. It does not heal itself. It's a lie when the doctor tells you it will. They're lying to you for a reason. They're lying to you to get your business. Physical therapists will tell you, go to physical therapy for 6 weeks and your disc will heal itself. That's a lie. It will not. It might feel better. It will feel better as you take it easy and you start to use good biomechanics. The therapist will teach you good biomechanics. They'll stretch you, they'll work your muscles, they'll put you on machines. But the reality is, what's happening in physical therapy is the inflammation is dying down. The inflammation is dying down. And that's why the pain goes away. The inflammation dies down. So, but the problem is the moment you get up and start doing things, that herniation is still there, and it gets aggravated by the activities you're doing. And it's those activities that make the herniation worse. So you squeeze out some more herniation, another piece with activity. And that's the problem, is these doctors are telling patients your disc will heal itself when it will not. And it just settles down the inflammation with time, but the inflammation will be back again the moment you herniate some more disc out. And you're going to herniate more disc out because the tear, many times over the years, it's got great results, and it's curative of back pain. Your back pain will be cured. If it's coming from this disc, it will be cured with this procedure. Now let's show the audience how we cure discogenic back pain with a laser.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. You can see from our video that we use a laser and an endoscope to find the tear, get inside of it, and we use a laser to debride the tear, called the debridement of the annular tear, unique to the Deuk laser disc repair procedure, currently available here in Florida at Deuk Spine Institute. All right, questions? Because we're just about done cleaning up this tear. It's looking beautiful. Go ahead, Henry.
First question is coming from Lanu on YouTube, asking, his first MRI looks scary. Looks like he had a plane crash. How long has he had the pain?
Yeah, he's had pain for 30 years, back pain for 30 years. We would have fixed it on day one if he came to Deuk Spine. Next question.
Coming from Faisal on Facebook.
Hello, Faisal. Welcome.
Saying, hi doctor, hope you're good. See you early next year. I think artificial discs are the biggest con in spine surgery.
Yeah.
A lot of new young surgeons are promoting it to build their practices up for marketing purposes.
Yes, 100% right.
At least a fusion gets rid of disc pain if done correctly by yourself, for instance, and facet joint pain as the segment is fused so the facets can't move to cause pain. But of course, the ultimate treatment is your laser disc treatment and rhizotomy. Do you agree?
You are 100% correct. Every word you said, I 100% agree with. Faisal is right. The artificial disc is a scam, and people are buying into it. Fusion would be a better option because it treats facet and disc pain, whereas the artificial discs only treat disc pain. Even if it does treat pain, it doesn't usually. We're done. I'll take the next few questions. We're going to bring you back shortly and do the facet joints.
Next two questions. First one's coming from Thomas on YouTube, asking, how far under anesthesia are patients are getting under the Deuk laser disc repair?
That's a great question. So for the lumbar Deuk laser disc repair like this one, the most common one, they're in twilight anesthesia with propofol sedation IV. There is no respiratory support. We do put people with sleep apnea on a CPAP machine while we're doing the surgery, and we put some other people too just to help them. But there's no tube. If you do cervical Deuk laser disc repair, then they have to be intubated under general anesthesia. The next patient we're going to do is thoracic, and that patient will be under twilight as well. Next question.
Lastly, from Thomas once more on YouTube asking, what specifically causes weakness in the legs? Does it disappear when the Deuk laser disc repair is performed?
Yes, weakness in the legs, if it's coming from a herniated disc, it's due to pressure from the herniation crushing the nerve in the lateral recess or neuroforamen, one of those two places. Lateral recess, neuroforamen, crushing by the herniation, just sticking out, crushing the nerve. That's what causes weakness. With the laser surgery I just did, we're going to go in and unpinch the nerve by removing the herniation, and it's curative. It works every single time. All right, thanks for joining us. We'll be back shortly with the Deuk plasma rhizotomy for facet joint pain, left 3-4, 4-5, 5-1.